Good day everyone, I am 𝐬𝐨𝐜𝐚 from BSN 12D and I am here to show you my return demonstration in performing the Leopold's maneuver. Leopold's maneuver is a way to determine the position of the fetus inside the uterus. It is done after 36 weeks of gestation to help expectant mothers and healthcare workers to be prepared for the labor. It is also used to determine if it is necessary or safer to perform cesarean section. So prior to the conduct of the examination, I have prepared the necessary equipment needed to conserve time and energy. So I have here a pillow, a towel, and a stethoscope which will be used in listening for the fetal heart tone. And also, I have done performing thorough hand washing to protect myself and of course my patient from cross-contamination. Now I am going to explain the procedure to the patient, so this will elicit patient's cooperation. Good day, ma'am. I am 𝐬𝐨𝐜𝐚𝐥, your student nurse for today from Davao Doctors College. May I see your wristband, please? Can you state your name? How about your birthday? Okay. And how would you like me to call you? Alright. So today, ma'am, you'll be doing a Leopold's maneuver, which we use to determine the position of your baby inside your uterus. So later, during the conduct of the examination, I am going to feel your abdomen, which means I'm going to touch it with a little pressure for me to determine the position of your baby. Would that be alright with you? Okay. So ma'am, is it okay if I'll close the curtains and doors for me to provide you with some privacy and away from disturbances? Okay, thank you. So now I am going to ask the patient to empty her bladder first before the examination, as it promotes comfort and it allows for a more productive examination. And also, a distended bladder may obscure the fetal contour and it may slightly deviate the uterus. So ma'am, before we begin, I highly encourage you to void first before the examination so that later during the examination, you won't feel uncomfortable. Okay? So now that my patient is done voiding, I will now position the patient in a supine position with a pillow under her head and with her knees slightly flexed. So this is to facilitate accurate assessment and provide comfort. So now, ma'am, I need you to lie down with your knees slightly flexed and I need you to turn to your side so that I can put a towel underneath your hip. Okay? Okay. So now I'm going to place the towel underneath the patient's hip. Okay, so a flexed knee would relieve the tension in the abdominal musculature, and placing underneath the hip will displace the uterus from the inferior vena cava and aorta to prevent supine hypotensive syndrome. Okay, so now ma'am, I'm going to expose your abdomen. So always remember to expose only the areas to be examined and cover those areas that are not to be examined. Okay. Okay. So if right-handed, stand at the patient's right side while facing the patient. Now that I am facing the patient, I will now start palpating the uterine fundus to determine what fetal part lies in the upper part of the uterus. So this is the first maneuver, which is the fundal grip. So what we're going to do is to form a triangle shape and then place it on the upper part of the abdomen, which is the uterus area. Okay, and then palpate it. Okay, so you can tell if it is a fetal head, if it is round, hard, freely movable, and ballotable. And if it is breached, you can tell if it is softer and nodular. Okay. Okay. So after that, we're going to palpate on a downward direction at the sides of the abdomen, applying gentle but deep pressure to determine the position of the fetal extremities, which is the fetal back and anterior shoulder. So this is the second maneuver, which is the umbilical grip. And also in this maneuver, it would help us locate the fetal heart tone. So now we're going to palpate the abdomen using one hand. So we're going to place our left hand at the right side of the patient's abdomen, so it will serve as a support. So we're going to keep it steady And then we're going to keep our other hand, explore the other side of the abdomen, and vice versa. Okay? So you can tell if it is the fetal back if you feel a long continuous structure, and if it is the anterior shoulder, you may feel nodular. Okay? And then on the other side, okay. So next is to perform the third maneuver, which is the pollex grip. So what we're going to do is to place one hand over the pubic symphysis and then grasp the lower uterine segment between the thumb and fingers to feel for the presenting parts, and if engagement has occurred. So this maneuver will help us determine what fetal part lies in the inlet or in the pelvis. Okay? Okay, so to confirm for the presenting part, so it is the opposite of what is in the fundus. Therefore, the head is firm and the buttocks is softer and nodular. Okay, and if it is not engaged, it may be gently pushed back and forth. Okay. So now for the fourth maneuver, which is the last maneuver, the pelvic grip. So what we're going to do is to turn and face the patient's feet, okay, to confirm the result of the third maneuver and to determine the flexion of the vertex to the pelvis. Okay? Okay? So if the prominence is at the same side of the extremities, then the head is flexed. And if the prominence is at the same side of the back, then the head is extended. So now that we are done with the maneuvers, we are now going to locate again for the fetal back and place a stethoscope over it and listen for the fetal heart tone for a full minute. So a normal fetal heart tone is 120 to 160 beats per minute. Okay, ma'am, you are now done palpating your abdomen. So now I'm going to listen for your baby's heart sound, okay? Okay. So now I am going to locate again for the fetal back. I'm going to palpate again. Okay. So now I'm going to place the diaphragm of the stethoscope and then listen for the fetal heart tone. Okay, so now that I'm done listening for the fetal heart tone, I am now going to note it, including its character, location, and weight. So in cephalic presentation, the fetal heart tone can be heard on either side of the lower quadrant of the abdomen, and if it is in breech presentation, it can be heard on the level above the umbilicus on either left or right side. Okay. So now I am going to help and position the patient so that the patient can feel comfortable. Okay. So now, ma'am, you are now done with your examination. So now I'm going to cover you up. Okay. Alright. So I'm going to remove the towel. And I'm going to cover up the exposed areas. Okay. So, ma'am, after the examination, I have determined that your baby is in your right side and it is in cephalic position, which means that the head of your baby is in the lower part of your uterus, okay? And it is already engaged. So, this is the ideal position of a baby for labor, okay? And also in listening for your baby's heart sound, it is in 123 beats per minute, which is normal, okay? Alright? So, I think that's it, ma'am. Do you have any questions or clarifications about the examination that we have done? Alright, that's great. So, thank you, ma'am, for your cooperation and have a nice day ahead. So, now that I'm done, I'm now going to perform thorough hand washing to deter the spread of pathogenic microorganisms, and I'm going to document the observation made, including its fetal heart rate, fetal presentation, position, attitude, or if it is engaged or floating. So, this is to facilitate database for the future. Okay? So that's it for my written demonstration. I am 𝐬𝐨𝐜𝐿𝐴𝐷 canumay. Thank you for watching.